Gout is a painful form of arthritis. It often arrives without any warning. It can feel like your joint is suddenly on fire. This condition causes intense pain, swelling, redness. Many people experience their first attack in the big toe. Anatomical illustration: uric acid crystals in big toe joint. Imagine waking up in the middle of the night. Your toe feels like it is being crushed and burned. This is the classic signature of a gout attack. While the big toe is a common target, gout is not limited to it. It can also strike your ankles, knees, elbows, wrists, fingers, causing significant discomfort and disrupting daily life. So, what is happening inside your body to cause this? Gout occurs when there is too much uric acid in your blood. Uric acid is a normal waste product. Your body creates it when it breaks down substances called purines. Purines are found in many foods. Usually, your kidneys filter uric acid out of your blood. It then leaves your body through your urine. Sometimes your body produces too much uric acid, or your kidneys can't get rid of it fast enough. This imbalance leads to a buildup in the bloodstream. When uric acid levels get too high, it can form tiny, sharp crystals. Think of them like microscopic needles. Crystals travel through the bloodstream and settle in a joint. They also gather in the soft tissues around the joint. The immune system sees these crystals as foreign invaders. It launches an attack to fight them off. That immune response triggers inflammation, swelling, searing pain. Understanding this process is the first step toward taking control and finding relief. Public awareness about gout is incredibly important. Many people dismiss joint pain as a simple sprain or part of getting older. They might try to tough it out, hoping it will go away. But ignoring gout can lead to more serious problems down the road. Untreated gout attacks can become more frequent and severe. Over time, crystal buildup can cause permanent damage to joints, bones, and even your kidneys. By talking about gout openly, we can help people recognize symptoms early and seek help. Yeah, that's why awareness matters. The primary symptom of a gout attack is sudden severe pain in a joint. This is not a dull ache that gradually gets worse. It is an abrupt, excruciating pain that can wake you from a deep sleep. Many people describe it as a feeling of being stabbed burned. The affected joint becomes incredibly sensitive. Even the light pressure of a bedsheet or a sock can feel unbearable. This intense sensitivity is a key indicator you might be experiencing a gout flare-up rather than a different type of joint pain. Along with the intense pain, you will notice other clear signs of inflammation. Look at the joint. It will likely appear very red, even purplish. The skin over it might look stretched shiny. When you touch the area, it will feel warm or hot compared to the surrounding skin. Swelling is also a prominent feature. It makes the joint look larger than normal and feel stiff. These symptoms are your body's alarm system. They signal a serious inflammatory process inside the joint, triggered by sharp uric acid crystals. A gout attack usually develops quickly, peaking within 12 to 24 hours. The worst pain and swelling can last a few days. Symptoms usually subside over a week or two. Once it's over, the joint might feel completely normal again. That remission can be deceptive. You might think the problem resolved on its own, but without proper management, future attacks are likely. These systemic symptoms happen because your whole body is reacting to intense inflammation in the joint. Recognizing the sudden, severe pain, the redness, the heat, the swelling, and the feeling of being unwell is crucial for timely diagnosis and treatment. You know, early action really helps. You might be wondering what puts someone at risk for developing gout. There isn't a single cause, but rather a combination of factors. Genetics can play a significant role. If your parents or other close relatives have a history of gout, your own risk is higher. It is a condition that can definitely run in families. Gender and age are also important factors. Gout is much more common in men, who often develop it between the ages of 30 and 50. Women are not immune, but they typically develop gout after menopause, when their natural estrogen levels decline, which can affect how their bodies process uric acid. Your lifestyle choices and overall health have a major impact on your risk. Being overweight is a primary risk factor. Carrying extra weight means your body produces more uric acid, and your kidneys may have a harder time filtering it out. Certain medical conditions are also closely linked to gout. These include untreated high blood pressure diabetes, metabolic syndrome, chronic kidney disease. All of these conditions can interfere with your body's ability to efficiently manage and excrete uric acid, creating the perfect storm for a gout attack to develop and take hold. The things you eat and drink are also a huge piece of the puzzle. A diet high in purines can raise your uric acid levels. Purines are natural chemical compounds found in many foods. Foods that are particularly rich in purines include red meat, beef red meat, lamb organ meat, liver organ meat, kidney seafood, anchovies seafood, sardines seafood, mussels seafood, scallops. Drinking alcohol, especially beer, sugary drinks, foods high in fructose, a type of sugar, can also stimulate the body's production of uric acid, increasing your risk for a painful flare-up. Finally, some medications can raise uric acid levels as a side effect. For example, low-dose aspirin, certain diuretics, often called water pills, which are prescribed to treat high blood pressure or heart failure, can reduce the kidney's ability to remove uric acid. If you are taking any of these medications and are concerned about gout, it is essential to speak with your doctor. You should never stop taking a prescribed medication on your own. Your doctor can help you weigh the benefits and risks and determine the best course of action for your overall health. Well, talking with a clinician is the safer move. Aim to drink about 8 to 16 glasses of fluid a day, with most of that being plain water. This simple habit can make a significant difference in preventing the buildup of uric acid crystals in your joints. Focus on building your meals around foods that are naturally low in purines. Load up your plate with a colorful variety of fruits, vegetables. Cherries in particular have been shown to help lower uric acid and cut inflammation. Whole grains, oats, brown rice, barley. For protein, beans, lentils, low-fat dairy, milk, yogurt. Studies suggest milk and yogurt may help promote uric acid excretion. Let's look at a real-life example. A man named John in his late 40s was experiencing frequent, debilitating gout attacks in his knee. He loved red meat and would often have a few beers after work. His doctor explained the connection between his diet and his pain. John decided to make a change. He started by swapping his steak dinners for grilled chicken or fish like salmon. He replaced his after-work beers with sparkling water and a squeeze of lime. He also started eating a bowl of cherries for dessert. Within a few months, his attacks became much less frequent and far less severe. Just as important as knowing what to eat is knowing what to limit or avoid. As we discussed, you should cut back on foods high in purines. This means reducing your intake of red meat, organ meats, certain kinds of seafood. You should also be mindful of your sugar consumption, especially from high fructose corn syrup, in sodas, fruit juices, and processed snacks. Limiting alcohol is also key. Beer is particularly problematic because it is high in purines from the brewer's yeast. If you do drink, wine in moderation is generally considered a safer choice for people with gout. Well, focus on these changes and, small steps can really help. While diet and lifestyle changes are fundamental, they are often not enough to fully control gout, especially if your attacks are frequent or severe. This is where medical treatment becomes essential. The goals of treatment are twofold. The first goal is to provide rapid relief during an acute attack. Your doctor wants to stop the pain and reduce the inflammation as quickly as possible. To do this, they may prescribe medications like non-steroidal anti-inflammatory drugs, ibuprofen, naproxen to calm the inflammation and ease the pain. Another common medication for acute attacks is colchicine. This is an older drug that is very effective at relieving gout pain, especially if it is taken at the first sign of a flare-up. For people who cannot take NSAIDs or colchicine, corticosteroids may be an option. These powerful anti-inflammatory drugs, such as prednisone, can be taken as pills or injected directly into the affected joint to provide fast and targeted relief. Resting and elevating the joint, along with applying ice packs, can also help soothe the symptoms during an attack while you wait for the medication to take full effect. The second, and equally important goal of treatment, is long-term prevention. This involves lowering the level of uric acid in your blood to prevent future attacks and to stop crystals from forming. If you have recurrent attacks, signs of joint damage, or hard lumps of crystals under your skin called tophi, your doctor will likely recommend a daily medication. Drugs like allopurinol or febuxostat work by reducing your body's production of uric acid. Other medications, like probenecid, help your kidneys remove uric acid more efficiently. These are not for acute attacks. They are long-term solutions. It is absolutely vital to see a doctor if you suspect you have gout. Do not try to self-diagnose or treat it on your own. A proper diagnosis is key. Your doctor will likely ask about your symptoms and medical history. They may draw blood to check your uric acid levels. The most definitive test is to take a sample of fluid from the affected joint and look for uric acid crystals under a microscope. Once diagnosed, your doctor will become your partner in managing the condition. They will create a personalized treatment plan that combines medication with the lifestyle changes we have discussed. Receiving a gout diagnosis can feel overwhelming. The thought of sudden, intense pain can be frightening. The need to make lasting changes to your diet and lifestyle can seem daunting. But I want you to hear this loud and clear. You can manage gout effectively. You can break free from its fiery grip. Live a full life. Live an active life. Live a vibrant life. The key is to be proactive. Take ownership of your health. Knowledge is your first line of defense. Understand what causes your gout. Understand what triggers your attacks. Think of your relationship with your doctor as a partnership. Be open and honest about your symptoms. Be open and honest about your lifestyle. Be open and honest about any challenges with your treatment plan. Regular checkups are important to monitor your uric acid levels. Regular checkups ensure your treatment is working. Your doctor can adjust your medication as needed. Your doctor can provide guidance and support. Remember Sarah, a 62-year-old teacher who developed gout after menopause. She felt discouraged at first. She worked closely with her doctor. She started a daily medication. She embraced a Mediterranean-style diet. Today she is pain-free. She enjoys long walks. She gardens without fear of an attack. Small, consistent changes add up to huge improvements. Start with one simple change. Swap your daily soda for a glass of water. Choose a salad with grilled chicken instead of a burger and fries. Celebrate these small victories. Stay active to manage weight. Stay active to keep joints healthy. Try activities you enjoy, like swimming, or try walking. Gentle on the joints. Living with gout doesn't have to mean living in fear. Combine medical care. Combine dietary adjustments. Combine healthy lifestyle habits. You can prevent painful attacks and protect your joints from long-term damage. There is so much hope. You have the power to calm inflammation and reclaim your life from gout. Take that first step today. Talk to your doctor. Make a plan. Look forward to a healthier, more comfortable future. You can do this.